When you work in housekeeping or maintenance, in a kitchen or with laundry, you know it's important to keep things clean. That's your daily job, and you do it well. The 4 moments approach to hand hygiene will make your work safer for you and your family. And you will know that you're doing the right thing to prevent the spread of infections to our residents. The power to make a difference is in your hands. It's not just when your hands look dirty. The germs that cause infection are too small to see. Alcohol-based hand rub is the best way to clean germs from your hands. It's better than washing hands unless your hands are visibly dirty. Hand washing with soap and running water must be done whenever your hands are visibly soiled or dirty. Whenever you come into the resident's room, you need to remember the 4 moments. Moment number 1, clean your hands when you come into a resident's room using the alcohol rub before you touch the resident or any object or furniture in the resident's room. As your work takes you from one resident area to the next resident's area, you will need to clean your hands again between each resident's area. Moment number 2. You may see procedures called aseptic procedures, such as administering eye drops or assisting with oral care, dentures, etc. Whoever does these types of procedures must clean their hands to protect the resident against harmful organisms or germs from entering the body. Moment number 3. For your safety, you must always clean your hands if you've had any risk of contact with body fluids. Remember this when you do a job like clearing up urine, feces, vomit, blood. When handling waste like bandages, napkin, continence products, or when you're cleaning dirty or contaminated material or any areas like the bathroom. Protective gloves should be used if exposure to body fluids is anticipated. Gloves must be used correctly. They must be changed after each task so organisms are not spread by the gloves. Hands and gloves may become wet. Wet hands are a frequent cause of skin breakdown. Wear gloves for as short a time as possible and always clean hands after removing gloves. Moment number 4. As you leave the resident's room or move to another resident's area in the same room, you need to protect yourself and the home by cleaning your hands again before you move on to your next task or another resident's room. When you work where there are shared or group activities such as the dining room, activity rooms, hallways, treatment rooms, you need to clean your hands every time you begin a new activity and after you finish the activity. When we help people eat, we need to clean our hands and the hands of the resident before feeding them. And as you come into or leave the home, you need to clean your hands. By following the 4 moments and performing hand hygiene, you keep the residents, yourself, and your family safe. Look after your hands and look after your health. Just clean your hands.